Good morning, good afternoon, and good evening. Welcome to the 802nd day of continuous and uninterrupted Zoom session of IFPH. Today, our guest is Dr. Gurukiran in BHMS SCPH. Have graduated BHMS from Government Homeopathy Medical College and Hospital, Bangalore. Affiliated to Rajiv Gandhi University of Health Sciences. Classical homeopathy practitioner in the district of Chamarajanagar in Karnataka, India. 14 years of clinical experience, an independent researcher, post-graduation fellowship in SCPH, International Center for Homeopathic Medicine, United Nations. Presented papers in homeopathic approach for the treatment in different types of cases, especially psoriasis, thyroid problems, PCOS, epilepsy, hypertension, respiratory disorders, parahemophilia, GERD, alopecia areata, infertility, etc. The subject is homeopathic posology and insight. We all know that, in fact, this is the invention by Hahnemann. The other things, the law of similarities was there, but the consideration of the individual symptoms as well as this potentization and minimum dose is the novelty of homeopathy. You all know that the matter is always it is indestructible and infinitely divisible, and the quantity of action necessary to make any change in nature is the least possible. Well, these are the fundamental laws of posology in homeopathy, and I expect a nice session from Dr. Gurukiran. Of course, we always know that he's a talented person. So on behalf of IFPH, and welcome Dr. Gurukiran. You can have the platform for the next 45 minutes. It's over to you.
Thank you, sir. Good evening to all, and good morning to some of them. Today's topic is homeopathic posology and insight. I would like to present this topic especially because it's a very important topic for all practitioners and also neglected topic. That's why I chose the homeopathic posology. As we all know, friends, we have studied posology in BHMS years in the college, but with a lesser importance. We would have not given so prominence or so much importance while studying BHMS. But when we come to the clinical practice, when we go through the Hahnemann's works, it may be organon, it may be chronic diseases, homeopathic posology becomes a very, very important part in clinical practice. And its applicability is very well known to all of them, and its depth is more. So today, for the today's session, I have chosen homeopathic posology with few cases. First, I would like to stress upon the posology. Then, along with that, I'm going to show the cases, how we can apply the posology in clinical practice so that it will be complete. So that after getting knowledge of theory and application of it through clinical cases. So, first of all, we should be all grateful to this master, Dr. Samuel Hahnemann. Now, what is homeopathic posology? Posology is a Greek word. Posos is how much. Logy is study. So, doctrine of dosage. How much? Dosage. What? How can we prescribe after selecting the remedy? As we all know, we are going to select the remedies by totality of symptoms after listening to the case. All we know that. Then, what is the dosage? How much we have to give? This is very, very important as a physicians. Generally, all we practice with the potencies like 200 and 1 m. Why? Why not? We have got lot of potencies, and friends, we know that this homeopathy is a unique system in the world which has the capability to adjust the potency up to the material doses, up to the functional doses like 50 mcm. It is the only system in the world. Homeopathy is the only system in the world. We have that capability. It is the advantage and it is a plus point of homeopathic system. What are the potencies needed to treat cases? Whereas other systems only have the material doses. They don't have the potencies. We have the ability to adjust the potencies to the material doses up to 3, 6x, 6C, 12, and we can raise up the potency up to 50 cm, mm. We have such capability. So potencies. This is a recent paper which has been published by Chitkaramane, P.S. Suresh and A.K. Ballare from IIT, Bombay. Recently, it has been published in 2010, Homeopathic Extreme Dilutions and Nanoparticles. It is available in the public domain. Can search through Google and you can get the copy of it. It has clearly mentioned, and it has been it has been a very good breakthrough in homeopathic potencies. They have given in detail and they have shown the practical applicability and what does the dilutions contains. A well-selected remedy may fail because of the wrong dosage. This we should know. Some of the sometimes in the clinic, after selecting the remedy very well, by prescribing the wrong dosage, the case may get spoiled. Dose as well as remedy must be adjusted to the patient's need. As I said, this is a very plus point in homeopathy system, that we can adjust the doses up to the material doses, to the potency up to the functional levels. So Newton's third law. What is Newton's third law? Action and reaction. This all we know that in the high school, since the high school days. The doctrine of dosage is like the law of cure, based upon the discovery of the opposite action of large and small doses of medicines. The law of mutual action, that is Newton's third law. Action and reaction are equal and opposite. This is the Newton's third law. Homeopathic remedies are never used in physiological doses. This we should remember, friends. Homeopathic remedies are never used in physiological doses. This statement is true even in those cases where low reacting power of the patient sometimes require material doses. Homeopathic medicines are never used for their physiological effect. So these are the homeopathic mother tinctures. This should not be used according to the homeopathic principles. What about mother tinctures? Then what about allopathic medicines where they use material doses? This is the question. The physiological action of the drug is not in its therapeutic or curative action, rather pathogenetic. Suffering of the organism produced by the drug is expressed in symptoms which are the language of the disease. This should be remembered properly. Suffering of the organism produced by the drug is expressed in symptoms which are the language of the disease. As we all know, on the basis of this, we make the totality of symptoms. We repertorize the case according to the symptom totality. Then we arrive at the simillimum. After arriving at the simillimum, then our part is to prescribe the dosage. Therapeutic means curative, healing, or alleviating. Therapeutic dose must be capable of producing slight temporary aggravation. That's what we see in the Hahnemann writings. Also in the Kent's 12 observations. Therapeutic dose must be capable of producing slight temporary aggravations. So action of the drug. This is very, very important. Homeopathic drug acts upon the identical tracts involved in the disease process in a manner similar to the action of the disease producing the cause itself. This we should know. Some of them may ask that how does homeopathic medicine acts? So this is the theory that homeopathic drug acts upon the identical tracts involved in the disease process in a manner similar to the action of the disease producing the cause itself. How does the cause, from the cause, how does the disease evolve like that? It's identical tracts. So 5 consideration to the choice of the dose. What is that? It is a susceptibility. We should look upon the susceptibility of the patient, each and every case, before prescribing the dosage. And the seat of the disease, the nature and intensity. What is the nature? Is it a chronic case? Is it an acute case? And how it's the intensity? Is it severe or is it mild? That we should consider. And the stage and the duration, how long it is there, and on what stage it has come to the clinic, and the previous treatment of the disease. Is there any previous treatment or any abuse of any other drugs? We should also consider all those things. These are the 5 considerations to the choice of the dose. This is very, very important before the prescription. When to prescribe higher and lower potencies? This is the question. This should be very clear before prescribing the dosage in a physician's mind. When we should prescribe the higher potencies, when should we prescribe the lower potencies? Whereas one remedy, which is characteristic symptoms, is clear, which gives the higher potency according to the prescriber's degree of confidence. As we all know that 1M and above 1M is considered as higher potencies. So, when in a case where there is characteristic symptoms are very much clear, then we have the potential to prescribe the higher potencies. This is what it is in Materia Medica Pura also, where the symptoms are in what we say it is PQRS symptoms. The characteristic symptoms are peculiar, queer, rare, strange symptoms. When it is seen in the proving is, it is from the depth of the action of the remedy. So that when you see the PQRS in a case, it is the chance to prescribe higher potencies. It is sure shot. It is sure shot. In children and young, medicine should be given in the medium or higher potencies because the susceptibility will be high in the children and in the younger people. So we have the scope to prescribe higher potencies in these kind of cases. These are all very, very important clinical tips. Higher potencies are best adapted to sensitive persons, to intelligence. If you consider a patient, he is very intelligent, we have the chance to prescribe higher potencies. Intellectual persons, quick to act and react, and impulsive persons. If you get these kind of patients in a clinic, we have the scope to prescribe higher potencies. This should be remembered. And also the PQRS should match the case, the characteristic symptoms. And the lower potencies and larger and more frequent doses to torpid phlegmatic persons. If you see a patient who is very lethargic, who is very fat, flabby, phlegmatic constitutions, so we can think of lower potencies to start with. To start with the lower potencies. After getting some reactions after the medicine prescription, we can change the potency according to the progress. Slow to act, dull, coarse fibered, sluggish persons. This is the best to start with the lower potencies, like 30 potencies we can start. And person who take large amount of stimulants, like whiskey, drugs, and stimulants often require low potencies. Why is the question? Because as we all know that it's a stimulant, alcohol and all. So largely they consume every day. They consume every day. So the vital force is stimulated for many number of times. In that, higher potencies should not be prescribed at the earliest. We should start with the lower potencies. After getting some reactions, after prescription of the lower potencies, then we can, according to the progress, we can raise the potencies. So person who is having, who comes with the drug addicts, large alcoholics, start with the lower potencies. So in the terminally ill cases, when the patient does not react to well-selected remedies, given potency, resort to the lower potency and increase the dose to the point of reaction. So this should be very much aware that when the cases goes into the terminally ill conditions, what they do in the allopathic field, the patients get admitted in the ICU. It is intensive care units. There they start with the medicine with the material doses. So we have the chance to start with the lower potencies in these kind of cases. In terminally ill cases, we have to start with the lower potencies. Then also, we should also remember that after giving lot of material doses in hospitals, in ICU especially, in some point of time, the reaction will be nil. As we all know that doctors will say they are not responding. That is the time where we have to increase the potency. That is the time where we have to change the potency. They don't have the scope of changing the potency. They don't have the scope of changing the any other dosage. But in homeopathy, we have the chance and scope to change the potencies after prescription of some drug. So this should be kept in mind. Idiots, imbeciles, and deaf and dumb patients. Persons who have taken many crude drugs of allopathic, homeopathic often require higher potencies. Because, for example, if we get a case of diabetes, the patient suffering since 20 years, 25 years, there is no part in giving lower potencies. We should start with the medium potency. Or if the case is clear, if the case have the characteristic symptoms, if the functional disturbances are more that we can see, definitely we can go for a higher potencies. If not, there is no point in giving again the lower potencies like 6, 12, 30. Because already they have taking the material doses since 20 years, 25 years, 30 years. The vital force stimulants, the stimulation will be very, very less. So we have to give the higher potency then. What does the stalwarts say in homeopathy? Certain malignant cases, like certain malignant and also cases like typhoid may require low potencies of the indicated drug. In cancer cases also, we should start with the lower potencies. And the repetition may require in the cancer cases. So we should start with the lower potencies. And no sorts like sorinum, syphilinum, medorinum, tuberculinum also be remembered. These are all the blockbusters. No sorts are called as blockbusters. When we get blocked with some case, when we stuck in middle of the case, we should think of some no sorts or maybe sarcoats also. It will be very much helpful. And single dose of no sort is moderately high potency will sometimes clear up a case. This we should know. As I said in the fever session, a lot of cases I prescribe tuberculinum in between, especially in acute cases. Lot of cases. Also in diabetes, tuberculinum works wonders when we stuck in between, where there is no reaction after some time, after some days, the sugar, the blood sugar level will be stagnant with some 200, 170, 180, 200 within 240, 250. That's all. Whatever you give any potency, that will not change. In that part, we should introduce no sorts or sarcoats according to the indications. So aphorism 6 and 7. What does it say? It's a manifestation of disease. Says about the symptoms and signs of the case and the patient himself, how he presents the case and the person around him. And also physician's observation. This is very, very important. Each and every case we should observe. And portrait of the disease. This we know that we get in Organ of Medicine, 6th and 7th aphorism. So what does the Hahnemann say about that? About the doctrine of dosage? Is give a single dose of indicated remedy and awaits its full action. Until then, there is no repetition. Until then, there is no change of any remedy or change of any potency. The duration and action of the remedy varies with the nature and rate of progress of the disease. This should be remembered very, very, very carefully. The duration and action of the remedy varies with the nature and the rate of progress of the disease. That's why in acute conditions, we may repeat the doses. Especially in COVID cases, we are repeating the doses within 2 hours, within 4 hours, we are repeating the case according to the severity, according to the progress of the disease. Where there is a progression of the disease is very fast, very, very fast, there the repetition is required. Where the progression is very, very slow, we have to await its full action to complete. In cholera, the action of the remedy might be exhausted in 5 or 10 minutes. In another dose may be required at the end of that time. See, Hahnemann has written in his writings, he has repeated the doses within 10 minutes of time or after 10 minutes of time in some of the cholera cases where it gets exhausted. We have to wait and watch until the medicine action gets exhausted. Then there is a time to repeat another dose. This has to be remembered. In tuberculosis, the action of the dose, only single dose action might continue for 2 to 3 months. We should wait and watch. If we repeat in frequent intervals, then we will spoil the case. The only rule for the dosage, repeat the dose when the improvement ceases. Where there is no improvement, where there is no reaction, repeat the dose at that time. Allow a dose as long as improvement produced is a very good practice. Allow it after prescribing, allow it the dose until there is an improvement. When the improvement ceases, then we have to think of the another dosage. Especially in acute conditions, we miss the totality or we may not able to come to the nearest drug. In that case, we may go into prescribe 2 to 3 remedies or frequent change of remedies within a day or every single day we may change the remedy. This will definitely spoil the case. We have to make totality first according to the characteristic symptom, according to PQRS symptom. Then after prescribing the remedy, we should wait and watch till the improvement ceases. Then only we have the scope or potential to repeat the dose or to change the potency. When there is indicated remedy is acting very much wonderfully, very good, then there is no need to change the remedy then. We should only change the potency. This should be remembered. What does Dr. Vijaykar says? Dr. Praful Vijaykar says, homeopathic reactions and aggravations are changes occurring in vital organs and changes in superficial tissues and also in non-vital organs. So these are the changes what we can see after prescription of the dosage. So what are all the good signs after prescribing a right remedy and the right dosage according to the case? What are all the good signs? According to the Kent's 12 observations, slight aggravation of the symptoms appearing quickly. This is a very good sign after the right prescription. And it calls for suspension of medicine. We should wait. We should wait and see what does happen. Then we should have the scope to change the potency or change the medicine. It is the best evidence of the curative action of the remedy. So these are all the good signs we should remember. Changes in the patient. What can we expect? Remedy effect in acute and chronic disease conditions and in cancer cases. So what is the remedy effect? How can we see a change in a patient? First, as we all know that in acute or chronic conditions, physical generals should improve first, should get better first. Then the particulars, especially in acute diseases, particulars should get better in 48 hours after the prescription of the right remedy. In cancer cases, particulars should get better first, then followed by physical generals. This is very, very important, what we can observe in cases. If in cancer cases, physical generals gets better first, then the particular, it's a wrong direction. The remedy has to be changed. But not in general cases, in acute or chronic diseases. In physical generals should get better first, then the particulars. So when improvement ceases or old symptoms reappear and remain without change, it is the time to repeat the dose. This we all know. Remedy may be quick with short amelioration followed by relapse to original or worse condition. The remedy may be partial similar or insufficient dosage. This is very, very important. Then we should think of a dosage. What we have to do now. This is the physician's work. So, in beginning, and in suspicious and incurable cases that we all encounter in daily practice, especially when the case is not given full and we are not so sure about the remedy. Please start with the 30 potency. Start with the lower potencies. We are not sure about this remedy. After forthcoming with the next consultations, then if we get some clear picture of the disease condition, then we may change the potency to 200, then 1M, 10M and 50M according to the prescriber's confidence. Then difficult things is to learn to wait according to aphorisms 245, 246, 247, 248. What is that? There's a wisdom, the courage, and the patience. This is very, very important. That's why I have marked it with an arrow with a broader sense. With the patience is at the last, because we should all have the patience to wait after the prescription. We should wait and watch. Then we have to think further. So let me move on to the case now. How can we see in this? How can we apply this doctrine of dosage in the cases? This is a very, very interesting case. A known case of subclinical hypothyroidism since 1 month. It was a lady was presented with symptoms of hair fall with increase of weight, headache right-sided, and pain in the right side of the cervical region of the neck. This was the presenting complaints of the patient. I would not go in the detail with the case. The constitution, what I decided was, it was lycopodium. I started with the constitution dose, lycopodium 200. This is the lycopodium picture. The thyroid profile was advised to repeat after 3 months of the treatment. The TSH value reduced from 11 to 5.6. I will show the reports. The patient was on placebo for a month. The patient started complaining of headache and hair fall. Lycopodium 200 was repeated. Headache reduced, but hair fall persisted. Patient was advised to repeat the test after 3 months. TSH value was raised than the previous one. See, this is the first report. What I'm showing is the TSH value is 11.06. After the prescription of lycopodium, the constitutional remedy, it is 5.6. After that, I kept the case in lycopodium 200 only for 3 months. Again, there is a slight raise of TSH value is 8.9. This is the date, what I have prescribed. The date is also mentioned here in the slide. What shall we do now? It's a very, very big question mark. This is the time. Is this the time to change the remedy, or to retake the case, or to change the potency, or to change the dosage? What shall we do? Then the higher potency was prescribed because I was very much sure about the remedy, what I have prescribed. That is a lycopodium. Then the higher potency was prescribed, lycopodium 1M, 2 doses for 2 months, only 1 dose per month. Then thyroid profile was advised. See the result. The TSH value is 3.87, became normal. This is the power and the potential of the right dosage. This is doctrine of dosage. When we are short of the remedy, when we are confident this is the right remedy, there is no point in changing the remedy if there is any changes in the reports or any investigations. Then only we should change only the potency or the dosage. If that also not responding, then we may think of retaking the case or change of any other medicines. This is case 2. A 7-month young child was presented with the skin eruptions over the left side of the shoulder and also in the left mandible region since 3 to 4 days. The eruptions were pustular with severe itching. Very, very irritable child. And very highly restless and hypersensitive child. Baby was not able to put the clothes on, especially on the shoulders. It becomes irritative to the child. This is the photograph of the child. What is this condition? This is impetigo contagiosa. Impetigo contagiosa. This was the case. A 7-month-old child. The baby was very, very restless, very hypersensitive child. the baby couldn't wear the cloth on the shoulders. The mother has to be always in the bare body in the home. So after repatrializing the case, skin eruptions, pustular, itching, and it is hypersensitive child. As we all know, Hepar Sulf is the oversensitive patient. Hepar Sulf 1M was prescribed because the susceptibility is very, very high in this case, especially a child, 7-month child. So I thought of prescribing 1M. Hepar Sulf 1M. Just after 3 days of Hepar Sulf prescription. See this photograph? Impetigo disappeared in 3 days after Hepar Sulf. This is the right dosage with the right medicine. The potency is apt to the case. Right potency. So posology in COVID-19 cases. This is a paper, actually, it's a research paper from the Italy at that time. In each individual case, only one single component homeopathic medicine has the product has been diagnosed and prescribed at time with only one potency, change individually according to the symptoms presented. This, as we all know, what I have told till now. This was the posology in COVID-19 cases. So, what is the takeaway message from the today's session? When there is a sora in background, that is in soric cases, 1M, 10M and above may require, and repetition may require in the cases. Nowadays, as pure soric cases is difficult to get in our clinical practice. As Hahnemann said, as Hahnemann has written in his writings, that if there is a soric case, sora is in the background, if the symptoms is characteristic, PQRS, and we have the confidence in treating that case about the remedy, then the potency should be 1M, 10M and above that, and repetition may require according to the progress. Especially in psychotic cases, lower potency has to be used. 3, 6, 30 and 200. Repetition may not be required because we have to wait its full action after prescription of the right remedy and the right dosage, especially in psychotic cases, in psychotic miasm having the background in the cases. What can we do in syphilitic cases? 200 potency is the apt potency in syphilitic cases. Repetition may require according to the progress of the disease, according to the seat of the disease. That's why I have mentioned the 5 consideration for the doses is the seat of the disease is one thing and the progress of the disease is another thing. So we have to keep in mind when we receive a case in the clinics, what is the miasmatic phase they have come in to us. We have to evaluate the miasmatic background and we have to consider it before prescription, every prescription. So each and every case we must individualize. It's a tailor-made, customized, what we say in the mobiles, customized. Low potencies will not cure acute diseases. All infants nor all age persons. This is very, very important points. Nor high potencies cure all forms of disease. This is what Hahnemann has said. All potencies are required. It may be anything. It may be 6, it may be 3, it may be 12, it may be 30, it may be 200. Any potencies. Any potency may be required in any given case. As a homeopathic physicians, we should be ready with the potencies required in the clinics. And I would like to thank to Dr. Praful Vijayakar and Dr. Manohar sir. Thank you for this, to take homeopathy as a passion. So thank you for the today's sessions.
Doctor, you mentioned that in case of cancer cases, the first thing you need to observe is the changes that appear in the particular symptoms than the general symptoms. But in general cases, you mentioned the general symptoms as I understand it. Is it right?
Yes, definitely, sir.
Yeah, if it's so, from where you got such observation and how you made such a statement, can you elaborate on that?
Definitely, sir. I have treated a lot of cases. And my senior doctor also, Dr. Manohar, also treated a lot of cancer cases. he has the data around a lot of cases in treating in those cases. Especially, he has got wonderful results after getting improvement in those cases, especially in cancer cases. Particulars has recovered, particulars has improved first, then the physical generals, and it has the very good durability. The beneficial is longer time.